Right now, if you compare the pain that you have right now to that what you had before the surgery, how's that?
Different.
Yeah?
So the pain that you
Yeah.
had before the surgery is gone.
Yeah, yeah.
Uh-huh.
Yeah.
Now
Sure.
it's just, I can tell it's now just the muscles and the, you know, from the stretching.
Yeah.
That's really it. And the incision, but that's nothing, so.
Ja, das ist es noch.
The new pain is going to decrease over time. Sometimes it takes weeks, in some patients it even takes longer than that. That is something that is, well, not so easy to predict, one can say. So patients differ a lot there, as you can, or have probably noticed during your stay here too.
Definitely.
Yeah.
If I had seen ahead of time visually like what it was going to be like, I would have been able to maybe prepare a little bit better for myself. And if, for instance, because the main problem for me was the belly. So maybe I would have brought a food that I was very used to eating every day that would maybe, I don't know, maybe that would have helped things progress a little bit better. There's a couple language barrier issues, but we're able to work through them. So minor things, but you know, a little bit of confusion, but you know, it was good.
Ja.
Does the physiotherapy, is that something that I should be doing every day?
Die Physiotherapie, die sehen wir so an wie...
Our attitude towards physical therapy is the same as towards brushing one's teeth. There should be no discussion of getting down to it today or tomorrow.
Should be something in the daily routine.
Okay. Bye-bye.
Okay.
See you Friday, Sunday,
Yes.
Saturday. We'll
Sounds good.
inform you.
Okay.
Okay, great.
Good.
Bye-bye.
Heidi Lippert's choice is the Park Hotel, reputedly one of the 100 most beautiful hotels in the world. It is easy to get lost in the maze of stairways and corridors leading to its 177 rooms and 18 suites. In addition to the fitness center and spa, the Park Hotel also boasts an ambitious gourmet restaurant. In the hotel, you may enjoy Hans Janssen's famous massages. Mr. Janssen uses a combination of classic massage, reflexology, and Dr. Manit's key point massage. The city of Bremen was founded by Charlemagne in 787 AD. Located 41 miles from the sea, Germany's oldest maritime city is also the country's second largest port after Hamburg and the smallest of the 16 German states. Bremen Town Hall, the Rathaus, celebrated its 600th birthday in 2005 and is a UNESCO World Heritage Site. Despite the bombings that destroyed the city in 1945, the Market Square and Town Hall remain architectural jewels to this day. Around the corner from the Market Square is the Hilton Hotel.
It was pretty bad for the first couple nights in the hotel, or the first day and a half. But then I got up and I got moving, and I went into town and walked for about 2 or 3 hours, just very slowly around
Getting
town.
better.
And it was much better after that because it loosened, the muscles became warm, and so it was much better after
And
that.
Hans coming in.
And Hans with two massages.
Okay, that sounds
Yeah,
good.
that
I like
helps. That helped too.
Magic hands.
Yeah, oh, he does such a wonderful job.
Magic hands.
So I'm wondering if there's additional medication or something that I can use to alleviate that just for the flight.
Seit einem halben Jahr angefangen haben, das gleich von vornherein mit Oxygesic abzudecken.
We
Haben wir
would
früher auch nicht gemacht.
ad-
Jetzt
advise you to take oxygesic, which is a morphine derivative, just for the flight. For example, on the night before the flight and also on the morning of the flight.
Okay.
And then if you need one extra during the daytime too.
Okay, good.
So we'll hand those out to you.
Okay, good. And then when I get home, because I was given a whole bunch of medication, you know, to continue with, how do I know when it's time? Is there a certain number of days I should be taking this medication, or how do I know when it's time to decrease or stop taking?
As needed. It's meant only as support. If she feels she needs pain medication, she should take some.
Okay. Sounds good. And what if something goes wrong when I get home? What do I contact Stenum or?
You should contact us if a symptom proves consistent and shows a tendency. For example, this week the pain has been worse than the week before. Next week again it's getting even worse. Hence, when the symptom clearly isn't a one-off for a day or for a week. But if you feel that there's something actually developing, do get in touch.
He thought it was just the coolest thing and the greatest thing that it was available to Americans, and that it was kind of a package deal. It was easy to do. One price includes all of, everything, because I've never had surgery back in the U.S., but from what I understand, there's one price for the doctor, there's one price for anesthesia, one price for medication, one price for hospital, and it's all invoiced to you separately and very confusing. And when I was there and asked them, can you tell me up front, if I were to do this, how much it would cost, and provide me with a list, details, how much for this, how much for that. The hospital never even called me back. They just didn't want to put the energy into, they wouldn't provide the information. So it was really challenging. So it was just such a blessing and so nice to be able to, get in and find on the internet, and it's all very clear, very easy, and very comforting to just know. Yeah, it's very clear, so.
Kevin and I have been the nurses for Heidi, helping her with her bandage and that kind of thing. How should we do that? We notice there's some little tapes across the side, and there's a little dried blood area, so is there anything you can coach us on as her nurses as to how to help her with that?
Well, those straps should be removed after about 10 to 12 days. The little loops of the suture sticking out, they fall off eventually. So that's a resolvable suture within the upper layer of the skin. If they don't fall off by themselves, you can just cut them with a normal pair of scissors. And once the crusts are falling off, the blood crusts, you can take a bath or go swimming.
I was just wondering if there was anything that she can't do when she gets back to the States, any sports or any kind of physical activity that she can't do.
If pain-wise you feel fine, then driving, of course, is not a problem. And other than that, we advise you to follow the rules of back school, especially for the first 6 to 8 weeks. And after that period of time, slowly increase the level of physical activity. And your body is mainly going to tell you itself what you can do and what you can't. So listen to pain and listen to the levels of activity that your body tells you to.
To give you an idea, the stress is much higher if she laughs or if she lifts one leg while seated than when she just walks around.
Ist die Belastung viel größer, als wenn sie hier durch die Gegend marschiert. Hier, ne? Das muss man sich im Klaren sein. Mit anderen, das Ding wird sowieso belastet.
This has to be well understood, but the implant is under constant strain anyway, so there's no point in being afraid of smaller actions.
Was wir gestern früh sagten.
I think that's all the questions I had. Covered everything, so thank you.
Okay, no worries.
Okay, then have a good trip.
Thank you very much.
Thanks.
Thank you.
Have a good trip.
Thank you very much.
And if questions arise, let us know. Okay.
The ADR solution primarily restores disc height in order to relieve pressure to the nerves and to remove the damaged and sometimes painful disc tissue. This is to maintain flexibility and thus limit damage to the adjacent levels. Once the functional defect is corrected, pain relief can be instant, or it may take months before it's enough to be significant. Some pain is likely to occur or even return from time to time. Don't worry, this is normal. Look at the overall results and progress over time, and be realistic about your expectations, and take it slow. We would like you to keep in touch. We are interested in your complete recovery progress, and we encourage you to contact us with regular status